Hi, Farmies. This is a little bit of a redo because we talked about the combination of estrogen and progesterone yesterday, but we're going to talk about progesterone all by itself today in the form of Medroxyprogesterone or Provera. This is what I want to talk about today is the use of Medroxyprogesterone to treat endometriosis. So what is endometriosis? Endometriosis is when the uterine lining grows outside of the uterus. And some people actually call it estrogen dominance because what we're talking about is a balance of these hormones. So this is my little tool for you today. So if what estrogen does is it causes the buildup of the uterine lining, and it causes when it spikes, it causes the release of the egg. So remember we said egg estrogen. Okay, so if we have high levels of estrogen and they're out of balance from where they're supposed to be, that can cause a constant growth or a buildup of the uterine lining. And in endometriosis, parts of that lining break off and go other places through the fallopian tubes to out into the peritoneal cavity. You can get scarring and adhesions. And those are called endometrial implants. So what progesterone does is it helps reduce the ability of those implants to grow. So when we give a higher dose, we're up here with estrogen. Remember, we have estrogen dominant. It's out of balance with progesterone, and it's causing endometriosis. So when we give progesterone, we tip estrogen back down, and now progesterone becomes dominant, and that prevents the lining from growing out of control. So on a normal cycle, estrogen spikes and builds up the lining and releases the egg. Then if there's a pregnancy, then progesterone comes in. If there's not a pregnancy, then the progesterone levels off, and they just kind of do this all the time. It's supposed to be in a nice balance at different parts of our cycle. But with endometriosis, we become estrogen dominant, and that causes that proliferation or hyperplasia of the uterine tissue. So we have to fix it by giving the opposite. So we have to balance it out by giving more progesterone. Okay, so estrogen and progesterone is a little bit complicated, but we're going to give Medroxyprogesterone. In this card, the card that I gave you only talks about it in terms of conception, but we also need to think of it in terms of a treatment for endometriosis. All right, have a great day.